Iowa health officials are encouraging families to be proactive about their health as the state has its third confirmed case of measles. Each of these cases has been found within just the last month. Joe Habersham joins us now in studio with tips on how families can keep themselves safe. Good evening, Joe.
Good evening, John. These cases that we're seeing are some of the first found in Iowa since 2019. That's according to the Iowa Health and Human Services Department, which is also reporting that nearly 1,200 measles cases have been found in the U.S. Just this year. Confirmed measles cases in the U.S. this year, already 4 times the total in 2024.
So it's really dangerous because it is the most contagious infection, I think, that we know of.
Dr. Melanie Wellington works as a clinical professor of pediatric infectious diseases for the Stead Family Hospital. She earned her PhD in microbiology and immunology 20 years ago and says MMR vaccinations are the only way to get these numbers under control.
Measles is a severe viral illness that can cause a lot of disease and even death. But we have an incredibly safe and incredibly effective vaccine.
According to the CDC, 1 dose of the measles, mumps, and rubella vaccine gives families a 93% protection against the illness. A second shot bumps you up to 97% for life. And the more immunized means the higher rate of herd immunity, making it less likely for outbreaks.
Because that one person has measles, they'll get very sick, but they won't infect him because all of the people they come in contact with are protected.
What could it look like if someone who does have a measles vaccination ends up getting this?
Somebody who got measles who was immunized would probably have a less severe case, but the symptoms would be the same set of symptoms.
Dr. Wellington says it could take your body anywhere from 2 to 6 weeks to get used to a vaccine. She also added that those infected are still contagious well before they feel sick. It's why Wellington encourages families to get their vaccines this summer, so kids are fully immune before the start of the school year and families have some protection for their vacations.
Your neighbor may have traveled to someplace where measles was circulating last week, and if you're over there having dinner with your neighbor, they may feel fine, but they may call you 4 or 5 days later and say, well, it turns out I have measles and you were exposed.
Now, the biggest symptoms to look out for are fevers, coughs, watery eyes, running noses, and rashes. If you're experiencing a combination of those, you should call your local health department and doctor. Those infected want to make sure they stay away from emergency rooms, though, to avoid spreading measles to families with weakened immune systems. John?